Hello everyone, my name is Luqman Siddiq and I'm the coordinator of Alfaisal MedHub under the umbrella of the International Office at Alfaisal University, Riyadh, Saudi Arabia. I'm honored to be your host for today. For those of you who don't know what Alfaisal MedHub is, it's an initiative under the umbrella of the International Office, College of Medicine, that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's career guidance series addresses this challenge through the perspective of accomplished and experienced seniors. Today, we are having our third webinar on Saudi residency program applications and interviews from the lens of program directors. We would like to mention that these talks are being conducted in partnership with AMBOSS. Joining us today is Dr. Khalid AlMatham, a consultant nephrologist and a former director of the Internal Medicine Residency Program at King Fahad Medical City. Currently, he serves as the director of the Postgraduate Scholarship and Administration at KFMC. Dr. AlMatham is also an adjunct assistant professor of medicine at Alfaisal University. Dear Dr. Khalid, we are honored to host you today. Thank you for kindly accepting our invitation.
Thank you so much for the invitation, and it's my pleasure to be with you this evening. So thank you again.
Okay, we will now begin the webinar. We'll now begin the webinar in an interview style format. We have a set of frequently asked questions by residency applicants that we would like to ask you.
Sure.
Just a second. Okay, so could you give us an overview of internal medicine as a field and internal medicine residency in Saudi Arabia?
Sure. So at the beginning, Bismillah ar-Rahman ar-Rahim. So if we talk about the Saudi Board of Internal Medicine, it's a 4 years program, and usually it's divided into the first 2 years is a junior, and there is the second 2 years are the senior level. And in the juniors, there's a certain set of rotations that there is a blueprint and roadmap for the rotations that you have to do during the residency to be able to accomplish that. And they include general medicine rotation, which is composing the main bulk of the rotation, and then you will do the subspecialties of internal medicine. So you have exposure to the general medicine and the subspecialty. For example, like nephrology, rheumatology, cardiology, oncology, and etc. In addition, during the 4 years, you will have a chance to have 2 elective rotations that you can do according to the institute. Either some of them may be junior level or at senior level. Before you move from one level to another, like from the junior level to the senior level, of course, there's the first part exam that you have to pass it before you get promoted to a senior level. Of course, there are some privileges that, for example, for the procedures and skill that you are able to do. So it can be either under direct supervision or indirect supervision. And once you move to the senior level, of course, this will change with time. At the end of the 4 years, you will sit for the board exam. And usually the board exam, we have the written exam, which is a set of MCQs. And then you will have the clinical exam, which is in form of OSCE exam, where you will have clinical cases. So this is the program in brief.
Okay, doctor. Our next question is, some would argue that internal medicine is going to become saturated in the main cities in Saudi Arabia within the next 3 to 4 years. What are your thoughts on that?
That can be a change, but we have to remember that if you talk about general medicine, still there is a need. We have a lot of opportunities. I think now we have more hospitals opening. Also now the private sector is coming now with the new transformation. So I think the opportunities for general medicine or internist is still there, is available. And I don't see that in 3 or 4 years that it's going to be saturated soon. Also, it's not just only general medicine. We have the subspecialties where there's a lack in most of the subspecialties for physicians.
Okay, doctor. Doctor, could you tell us what you look for in internal medicine residency applicants?
Actually, when I do an interview for an applicant or an review as a submitted request for the residency program, first thing I would like to see the interest. Do the candidate really like the internal medicine or not? We don't have a lot of procedures there unless it's in certain like subspecialty. So if your passion is doing like hands-on skills and procedures, then maybe it's not the best choice for you. For example, we have in cardiology, maybe in ICU, in gastroenterology, yes, we might have, but it's limited number of procedures, not like surgical procedure. So I want to see exactly that the candidate really know what is internal medicine. Do they show interest reflected from their CV, like they did, for example, some electives, they did some work like research or others. I think the passion for that is important. The other thing is that I want to see what are the things or the achievement that was done of the candidate. For example, do you have any publication? Do you have any like volunteering? How you are doing anything extracurricular from what is being studied in the college? Because everybody goes through the same curriculum, through the same rotations. Maybe they have almost like close marks or scores. So whatever you do to show that you have interest, you are distinguished, and you have done something extracurricular activity, it will be additional points to the applicant.
Okay, doctor. What are the do's and don'ts when it comes to CV?
Well, this is maybe it will need a whole talk, but if I want to make it like a brief, first thing, you have to be organized. And from the common things that we see, sometimes try to avoid any grammar mistakes, spelling mistakes. Make it organized, uniform fonts, for example. It doesn't have to be fancy one with a lot of colors, because it doesn't make a difference if the content it's not well organized and well prepared. And of course, you have to put the things in order that what you want to bring to the attention of the reviewer eyes. There's something that you think it's achievement, something important related. You have to make it the top of the CV, for example, so people will be attracted. Because if you have CV which is 8 pages, people will be looking for certain information, and usually they will look at the initial pages. So if you keep the best your achievement till the end, maybe it will be missed. Other things, don't put a lot of non-relevant data or like information at the beginning, because again, if you do that, that means you don't know what's the priority, what's the importance. So the reviewer will lose the interest in completing or going through the whole CV.
How many references would be a good number to include in a CV?
Well, it depends. I think I would say 3 would be good number as minimum, and too many references. First thing, like if you exceed 6 or 7, either that you are just putting references without really confirming with them, because if you put a reference, you have to make sure that the reference is going to verify whatever you have put in your CV, whatever you have mentioned either in the CV or during the interview. And you have to make sure that the reference or referee person that you are referring to, he will remember you when they give him a call or ask about you, he or she, of course. If you just put whatever numbers there and they don't recall you, it will be disadvantage. So I would be careful, put it between 3 to 6. This is from my point of view. And I will try to choose the people who know me very well. I work with them most of the time. And of course, people who are related to the field that I'm going to apply. For example, I'm going to apply for medicine. If I put the best surgeon, maybe I don't know him as an interviewer for you. But if you mention someone from internal medicine, yes, I know that person. I know how he is a good supervisor and he is going to give me a good comment.
Yes, Doctor. What do you like to see in someone's extracurricular activities, and how much do they add to someone's application?
Well, now since we are now the extracurricular activities, it depends. So we can make them two types. Something which is health related, for example, like volunteering. Yes, this is really important and it has some score. And I'm going to explore the scoring system in Saudi Commission later. So volunteering, it has to be something related to the health sector, and it's under supervision of well-known body. And there's the other extracurricular activities, for example, like personal stuff, like, yes, I like drawing, I attend sport classes or whatever. Yes, they are important. Yes, it shows that you are a really active person, you care about yourself. Maybe some of them will be of interest. For example, like someone who's interested in digital solutions. Yes, we are physicians, but also if someone have good background, might help to facilitate his work, might contribute to the work of the program, for example, like bringing up new ideas from this background. So it can be also added to the CV.
So basically anything useful in terms of skill and mainly related to the health sector in terms of extracurricular activities,
yes,
right?
Yes, so if I put them in order, I will put first what is related to the health sector, and in health sector, I will put first what is related to the subspecialty that I'm applying to, then any health sector, which is related or not. Then I will put, so for example, something personal, if I think it's something unique to show about my personality and characteristic.
Okay, doctor, thank you. How would you view research that is not internal medicine related?
Well, of course, it is important what type of research that you have done. Of course, if it is something like RCT, it will be great. If it's not an internal medicine, that means you have the knowledge, you have the interest and the passion to go through it. If it is cross-sectional, if it is case report, yes, they are good. Any research that you will put there, it's important. But the degree of how important is that is variable according to the type of the study and what's your contribution in that study. If you are the first author, this is great. If you have letter from the program director indicating, or the supervisor of the research, what was your role? Of course, if you are just collecting data is different than someone who is writing the manuscript, someone who's submitting, or just someone actually whose name is there only. And just one important tip is that if you put your name in any research, you have to know exactly what is this research and what was done, what was the objective and everything. And this is one of the mistakes that it happens most of the time, that you put like 10 researches, and when they ask you about one of them, what is it about, you don't know, because your name is there just by chance, which is, I think it's not a good point during an interview to put something that is not true. If you have one research and you know it very well, it's better than 10 researches that you have no idea about them.
Yes, Doctor. Doctor, what do you look for in an interviewee, and how can someone stand out during interviews? And on the other hand, what are some red flags in an interview?
Okay. Okay. So for the interview, of course, it's good always to come when you are prepared. You know that you come, prepare yourself. You have to be calm. I know it is sometimes challenging. It's not an easy to be. It's easier said than done. But you take enough sleep. Come prepared with um, certain information in your mind that you want to show about yourself. And what I want from you is that you have to be honest, and you know your limitation. Okay, because the type of interviews are different. For example, I'm interviewing someone who just graduated and they want to enroll into a training program. My expectation for the level of knowledge and the answers is it's set at certain level. What we ask during the interview is that we want to see how do you react to the questions. How do you think? Are you confused? Are you like hesitant? We are judging your personality and your reaction. We are not testing mainly your knowledge. For example, yes, we might ask about common like medical knowledge, like management of certain emergencies in medicine, which we expect someone who just graduated to know them. But what we are judging also, if you don't know, you don't make up things. This will be the worst scenario. If you cannot recall, just be honest. Say, I don't remember this. I'm not sure. I have to go back and read it. I need to review it again. But the worst scenario, if you start and give wrong answers because you don't want to say, I don't know, you will give information that is wrong. And also you have to have an intelligence to pick up the cues. For example, if someone asks you, are you sure? Maybe they want to give you a second chance to verify your information or take back what you said. If you say, yes, I'm sure, and you are wrong, this is the worst. So this is the confidence in wrong way. So if you are not sure, say, I'm not sure, I need to go back and review that. So I think coming prepared, you have to be calm. It's not an exam, it's just an interview to say what you have. They want to know about you. The second thing, you have to be honest. And also there is certain type of question judging the characteristics. So you have to know about them. For example, I might put you in a scenario and I'll ask you what you will do next. Always you have to know when to stop, and you will call for the senior, for example, because you are not expected to know everything. And in medicine, you are not expected to do everything in medicine. There is certain limitation. So you can say, I would ask a senior, I would call my senior. Okay. I think these are the most, of course, there are certain, for example, websites, they are putting some answers and clues. There is no like perfect answer. It's just be honest and show yourself.
Yes, it's better to know our own drawbacks than
the red flag.
Oh, sorry.
Sorry.
Nothing, Doctor. Go on.
Yeah, the red flags are if you are writing something that in your CV and you don't know it, or you are not honest about your answers, or you don't know your limitations. I think these are the worst red flags. This is what I call the most common red flags that we see in an interview.
Yes, Doctor. What are some questions applicants should avoid when it comes to the end of the interview when you ask the applicants if they have any questions for you?
Well, there's nothing like specific. It depends on why they should why they are asking the question, because sometimes they ask them why do you want to know, and it depends on their but when we open it at the end and we say, do you have any question, we expect certain questions. For example, like am I going to be hired? Am I going to be sponsored, or I will be sponsored by someone? When I'm expected to hear back, how do we get the result? Yeah, all of them are common questions that we face. I think that one of the questions that we don't like, for example, in interview, am I accepted in the program? So usually we don't review it because we are having many applicants in the same time. So the result come after the end of all the interviews. So just be confident and don't show that. For example, I'll give you a scenario that they sometimes ask us, am I accepted or not? When I ask why you ask, they said, because I have other interviews that I'm going to drop if you accept me. Well, I don't think this is something wise to be done, even if they assure you, because there are other good applicants other than you. So don't ask this question. Go for all the interviews that offer to you, and then you will put your ranking or matching like choices according to what you think is the best. So avoid this type of question at the end.
Okay, Doctor. What are your thoughts on post-interview communication, such as thank you emails?
Well, it depends from person to another. I think it's not necessary. Some people might take it as a negative. Some of them, yes, they will accept to see it as you are so kind. I would say that whatever you show during the interview and thanking people at the end of the interview is quite enough. Because some people, they perceive it as extra kindness or being polite to the committee, but some other might perceive it in the wrong way, that you just want to ask about the result or remind them about yourself. I think if you want to impress them, it has to be through the interview itself.
Yes, Doctor. How much weight do letters of recommendation hold, and what makes a strong letter of recommendation?
Yes. Of course, the letter of recommendation, it depends on, first, is it someone from the same specialty or not? If someone who's well-known in the subspecialty, someone who's known to be a good supervisor, so that person is really, when they write a letter, that they mean it. It's not just any letter that is pre-printed for everyone. And of course, in the letter, it will be like detailed. It will mention exactly why you are good, what you did to be distinguished from other colleagues. If it is just system-generated recommendation letter that is general for everyone, it does not make real difference. So these are the main, I think, Three things is from same specialty, well-known supervisor or person, and it's really detailed and it's really directed to you. It's not a generated letter.
Okay, doctor. How important is it that the applicant get a letter of recommendation from someone in the specialty that they're applying for? And is it fine if someone submits a letter of recommendation from physicians in other specialties? I think this was related slightly to the previous question, but it was
Yes.
another one of the frequently asked questions.
Yes. Again, yes. It's as I mentioned, it's important to be from the same specialty. Of course, if you have a letter from another subspecialty, maybe that you work with, and you did something impressive from someone who is well known in that subspecialty, it will be great. Again, it has to be a strong recommendation letter directed towards you, not generated. This will make a difference because when we read, we go through like hundreds of applicants, and we see like similar recommendation letters, and we know which one is truly given because that candidate is a unique candidate, did something extra, or it's just because they asked it was giving to them because they are kind and polite.
Okay, doctor, thank you. Is there such a thing as a letter that is too old?
Well, usually the recommendation letter, it's either come from two scenarios. Is either that you did a rotation during your internship, so it's not old, especially if you just finished your internship. The other one, if you did, for example, after you complete your internship, and there is usually a period of time, a gap between finishing the internship and starting the application or submitting the matching system, where you have to do some training, clinical attachment, some activities. So if it comes from those two resources, it's not an old. If it is something, let's say, come from the second year of medical school, for something you did, it's not related to the clinical part, then maybe it's not acceptable as like something fresh, especially if it is the only one. For example, you did something in the second year and then you have no other like recommendation letter in the coming years or the following years, then that means there is something about your development and progress. Maybe you are doing well, but your level has gone down. That's why you don't have any new recommendation letters. Yes, I would put them like one among others, among new ones, but I will not present only the old, which is something I did on my earlier years.
Okay, doctor. Do you have any advice for unmatched applicants to improve their odds for the next year?
Well, for the unmatched, I would, my advice for them, first thing is that they have to be sure about the subspecialty that they are interested in. And one of the problem with the scoring system is that if you put your interest in all subspecialties, there is a scoring point for that. So if you put your interest is medicine, surgery, pediatric, like everything, then it means you are not really interested in that subspecialty. I don't say that, for example, the require or let's say the preferences are 10 choices and you will make all of them, for example, medicine, no, but maybe you'll make at least the first 5 is medicine and then you will go for the choices. I will understand that, yes, you are really interested, but you want to make a plan B just in case you are not matched in medicine, for example. So showing the interest is number one, and then you have to work in the same subspecialty that you are interested in. So when you apply for it, they will know that you really want it. And you cannot, for example, say, I want medicine, and you go and do practice in pediatric, and then you apply with a recommendation letter for pediatric. Then it's not going to add more to your scores or chances. Also, volunteering is important. It can give you more. If you do any study, for example, like you do, let's say you take a diploma or take masters or whatever is related to health sector, it might be an additional point for you. In addition, that you will try to do some research in the same subspecialty. All these are important factors that will help to increase your chances of acceptance. And if you allow me, I can just give you in a brief, like what they look at, or I'm not sure if this is coming like in one of the questions. What are the scoring points in the Saudi Commission, or you want me to mention it now?
Doctor, do you want to share your screen or something?
No, it's fine. I can mention it, but I mean, do you want me to give this, or there's another question about the Saudi Commission scoring system?
I'm unsure if there is a question now, Doctor. I will. I think let's keep it for the end.
Okay, sure.
Okay. Anyways, I think this is the last question. So, any last thoughts or words of advice for our audience?
Yes, I think to be matched or accepted in any subspecialty or specialty like medicine, is that the interest has to start early from the final year, and you have to start building yourself during your internship. For example, you will when you do your core rotation of internship in medicine, you will make sure you will do it in a place, for example, that if you have the chance, of course, it depends on your university, if they give you a chance to go outside or not. You will do it in a place that you think that you want to be accepted in. You will work with people and you show yourself. You have to be there. You have to be impressive. If you go there and no one remember your name, or they just come and do regular work, you don't present yourself well, people will not remember you. And if you ask for good recommendation, maybe they will not offer it, especially the excellent supervisors who really give a good recommendation in the field. And so this is for the core rotation. And of course, think about taking electives. And one of the things that we look at during the interview, if you come to medicine and say, yes, I like medicine, but all your electives are done in something not related to medicine, then this is a question mark. So maybe we have to go and check back your preferences in the matching. What did you choose? Maybe you applied for pediatric and you did not match, and you come to medicine as second choice. This will not improve your scores. So do electives in the same subspecialty. Do research. Try to do volunteering. And when you do volunteering, do it in health-related sector with well-recognized body. And last thing, if there is any activities in the department, for example, a department of medicine, like morning report, if there's half day, try to participate. So try to present, make a good presentation. And this is one of the things that we notice. We we can distinguish people who really have a dedicated work and who trying to be impressive. People who just want to do something, like just give any copy-paste presentation from anywhere and just that's it to show it. Yes, there's a score for that, a credit that, yeah, you did something in comparison to someone who did not. But of course, the excellent work is different from the average work. This is the general advices that I can recall to prepare you for matching.
Okay, Doctor, thank you so much. Doctor, in the next slide, we'll be asking the audience if they have any questions. So to everyone in the audience, if you have any questions, please put them in the chat. Till then, Doctor, you can elaborate on the scoring system.
Sure. Okay, so when we talk about the scoring system in the Saudi Commission, so if you want to go into the matching, of course, if you go to the Saudi Commission website, you will find the dates. When do you apply and what are the requirements? And usually it is updated yearly. But if we talk about the most recent update that we have so far about the matching, we have the matching or the scoring. Let's say it's out of 100. So 30% will go to your GPA, and 50% will go to the Saudi licensing exam, or what we call SMLE. For non-physician or for dental, we call it SDLE, and for nursing, SNLE. And regarding the SMLE, you have you have unlimited number of trials, but in 1 year you have 3 exams. And I think last one usually is presented or offered during January. And of course, if you do, you don't have to do one and stop there. For example, you can go and do the 3, and you can provide the highest score. So you can see the SMLE has the highest score in the matching. So the higher the score that you achieve, it will be better. So you can take 2, 3 trials if you want and provide the highest score. It's not necessarily the most recent. Maybe the first one was the best. And then we have 20% for the CV. And what do they look in the matching for the CV? So I'm talking about the Saudi Commission matching system. I'm not talking about the interviews. So when they look at your CV, there is 6 points about the research. So if you have a research, not necessarily published, so you have the proposal, you have to bring the proposal, you have to bring the IRB, you have to have a letter of the program or the supervisor, indicating that you have contributed to that research. And if you do that, you will get 2 points. If you have a published study and you are contributing to that, you will get 4 points. And there is no difference if it is RCT or a case study. It has to be, you have to be mentioned there. And it's not necessary that you have to be the first author. If you just contributed, your name is there, then it is accepted. So if it is not published, it's 2 points. If it is published, it's 4 points. So other than research, if you have any other extra education, like if you have diploma, for example, if you have master, if you have something related extra training in medicine or in general, you can have 2 points. Then we have 5 points for volunteering. And for the volunteering, it has to be 2 activities. Each activity, it will be 2.5. So if you do 2, you will have the 5 points. And the condition for that, it has to be something done in health-related sector. It cannot be, for example, like the volunteering that is done in, for example, the medical, in schools. It's not accepted. And also it has to be supervised by a well-known health body, for example, university, hospital, and others. But if you do it with a body that is not known, it will not be accepted. Then, other than the volunteering, if you have a clinical experience of 6 months, okay, so it has to be 6 months in the same subspecialty, you can get 3 points. The other point also is if you have you have to show a strong interest. And a strong interest, this is what I mentioned, when you put your preferences in the Saudi Commission matching list, it has to show that you're really interested in that subspecialty. The same way that I mentioned, if you have 10 choices, at least 5 of them need to be the same. And how you will put the same, for example, you will put, I want to be matched in Riyadh, first interest. The second interest, if I'm not matched, I'll go to Eastern Province. I still like medicine regardless where I will go, but it's my first choice. Then, of course, you can put, for example, like pediatric surgery, whatever you like. Then I think this is mainly the points that is required for the matching system. Of course, the higher, the better the chances that you will find your first choice. This is about a brief the matching system.
We have 3 questions in the chat. I will read them out. Is there a chance to be accepted in a center where I didn't work on previously?
Well, yes, of course. It's not necessary. You cannot be working in all hospitals because you have limited chance during your internship, unless you have like a gap between the graduation and the acceptance. Yes, it's a good point, a general point, but it's not the whole thing. If you show that you really have an impressive CV, you have good recommendation, and you have to show them why you are interested in this hospital. For example, if you in your CV it shows that you did electives in hospital A, but you apply in hospital B, and they ask you, why do you want hospital B? Why not A if you are accepted there? You have to prepare an answer. You have to have an idea about that hospital that you are applying to. You have to mention the point that why do you like it? And it doesn't, and avoid general answer, like, for example, because they have better teaching. Sometimes it's not a good statement, because they will ask you, how do you know? Especially if the two hospitals are of the same level of let's say result and education and teaching, it will be difficult. So maybe you will ask, you will tell, well, I know someone in your program, and ask them a lot about the teaching, the activities, the type of work and exposure of cases. And I found myself liking this environment and the exposure and the challenge there. And I think I will get the most benefits. And I wish I would be accepted to prove myself, to show it. Another point, always avoid saying bad things about others. It's not acceptable at all. It's irritating to the interview panel. If they ask you about a hospital that you worked there, or someone you worked with, or whoever, regardless of what's your experience, you don't say negative things about others. This is not an acceptable statement in an interview. Okay.
Okay, doctor. There is another question. Doctor, what's your advice for non-Saudi applicants who want to match in Saudi?
In addition to the all points that we mentioned, I think it's not related about the candidate themselves, how they will increase the chances. It's about the availability of seats. I think the system, there's a priority, for example, like especially in certain subspecialty, where they will have the priorities for Saudi. So it depends on the specialty. I'm not sure if the system has changed, but my advice is, if there is a chance and there is an opening seat, again, the same advices that we said earlier. The question is that, why do you like my hospital? Why you want A, not B? You have to be aware about the hospital, the system, the setup. Even if you have some names in your mind, if you know a colleague, if you say, yes, I asked, I came, I visited the place, it all shows that you are really interested into the place.
Okay, doctor. There is another question. Should we write our GPA and SMLE score in our CV, or is it better that we don't mention it?
Well, it's usually it's part of the CV, and of course in most of the hospital anyway, they have a like an interview sheet where they will have your GPA and SMLE score and everything, because they are calculating. Yeah, it's fine. You can put it there.
Okay, doctor. There is one last question. What is the proper answer for the rank the center question?
So rank the center.
I'm not sure, doctor. Faisal or who asked that, could you please elaborate? Meanwhile, doctor, we'll move on to another question.
Yes.
Sorry, doctor, let me just read. This one as well, doctor. So, doctor, which is the better answer if they ask us to compare between us and other centers?
Well, yeah, it's a tricky question, and I don't think there's a lot of people will ask it, because it's not, and they don't want to know. They want to see how do you react. It's not about who's better. It's about your reaction. They want to see your personality. Are you going to hesitate? Are you going to be honest? So I would say, well, both of them are excellent, and I think they will provide good teaching. But from my what I heard and asked, I feel I will be better teaching or receiving my training here for the following, for example, reasons, or and it's my pleasure to work on both centers, for example. But again, as I said, even don't rush to say, if you, for example, they ask you which one is better, us or them. If you say you, okay, they will ask you why immediately. Okay, so if you answer both of them are excellent, the rush of cornering you and giving pressure on you will be alleviated a little bit. Okay, so if you say yes, both of them are good, and both of them are excellent center for training, but I prefer here, if I get matched for the following reason, it will be a good answer for you.
Okay, doctor, thank you so much. If anyone else has any questions, please put them in the chat. And yeah, thank you everyone for attending our talk on the Saudi Internal Medicine Residency Program, applications and interviews. Thank you for the wonderful talk, doctor. It was indeed very beneficial. We truly value your experience and guidance. I hope you all in the audience benefited greatly from it.
Thank you so much. It was my pleasure and honor to be with you tonight. I wish to all our attendees the best in their future career, and have a good day.